Welcome to Mental Health Matters, a compelling series brought to you by Ontario Shore's Centre for Mental Health Sciences. Every week, we share stories of hope, recovery, and resilience, accompanied by expert advice and resources to help navigate and understand the complexities of mental health. Situated on the shores of Lake Ontario, Ontario Shores is a dedicated public teaching hospital. We provide specialized assessment and treatment services for those living with complex and serious mental illness. Our unwavering commitment to exceptional patient care is built on safe and evidence-based approaches, ensuring successful outcomes through clinical best practices and cutting-edge research. From adolescents to geriatrics, our recovery-oriented environment fosters discovery, recovery, and hope. Mental Health Matters is an opportunity for all of us to learn, grow, and support each other on this journey of well-being. Each episode focuses on breaking down the stigma surrounding mental health through crucial conversations and fostering empathy within families, schools, workplaces, and communities. Join us as we embark on an exploration of the topic of mental health. Together, we make a difference.
Our first stop is at the core of it all, the heartbeat of Ontario Shores Foundation. Joining us are two remarkable individuals who play an important role. Please extend a warm welcome to Tracy Clegg, the CEO of the Foundation, and Joe Bromley, Chair of the Foundation Board. It's an honor to have you both here with us today. Welcome, Joe. Welcome, Tracy.
Thank you.
Thank you for joining us for Mental Health Matters.
Thank you for
I'm
having us.
Julie, your host, and I couldn't be more pleased to have you on this episode.
Wonderful. Thanks for having us. This is great.
Excellent. Thank you. So Tracy, thank you for joining us, President and CEO, new President and CEO of Ontario Shores Foundation. And Joe, welcome, Chair of the Board, big role. Would you mind sharing with us, how did you get involved with the Ontario Shores Foundation?
Sure. So I got involved with Ontario Shores a little over 3 years ago, actually almost 4 years ago now. And the reason why I got involved was both professional and personal. So I knew a lot about Ontario Shores through my regular work life, got to know a lot about the innovative and cutting edge things that the hospital was doing in terms of raising awareness of mental health issues, busting stigma in the mental health space, but also providing world-class treatment and world-class tools. So it was on my radar, and I always wanted to get involved with Ontario Shores, but what really got me to the next step in terms of becoming part of the board was I've had my own personal journey around mental health, have dealt with my own mental health issues as has family members. And, I really wanted to play a more proactive role in helping move the Ontario mental health system forward, actually the Canadian mental health system. And I thought, if there's something I was going to get involved in terms of the delivery of mental health services, this would be a great place to start.
Excellent. Well, thank you for your service. We're very glad to have you here. I'm going to turn the tables over to Tracy for a moment. You're in the hot seat. Could you share with us, let's take an inside look into the foundation. I know often people watching may not understand the function that a foundation plays for an organization like Ontario Shores. Can you share with us, in addition to raising awareness and initiatives, what is it that Ontario Shores Foundation does, and how does it align with the broader mental health landscape?
Sure. So, the foundation was established in 2009. So you think about it's, 14, almost 15-year-old foundation, and really we're a voice. We're the voice for the community. We're a voice of, we talk about stigma and how we can get around that stigma. And we're an opportunity to sort of add a voice and a choice for donors to make an impact on what we're trying to do for mental health. And, I've been here for 9 months, I guess now, and, working with Joe and our board members and working alongside the hospital senior team, it's really to try and talk about it and put something out in front of the community and to raise awareness about what we're doing in a really meaningful and tangible way, and to not shy away from some of the words that might be scary and they're hard to say. We talk about people suffering in silence. We talk about some of these words like suicide and what those mean to people. But, we talk about the personal journey and that life-changing care. And that's what Ontario Shores is all about. So, from my experience in the acute care world before here, it's a very different conversation and really important one. And I appreciate that you're allowing us to have it here. And donors want a way to help, and they want to understand what these stories are about. So one of the calls that we've asked people is to share your story, and it takes courage and it takes bravery. It also means that you might not want to share it in a traditional way, but you can use our foundation to do some of those things and to help us be your voice. So I'm grateful that I get the job that I get to be. It's a very special job in a very special place, and to work along colleagues like my friend Joe.
Excellent. Thank you. Joe, as chair of the foundation board, could you share the pivotal goals that the foundation steers? What are those efforts and how do you achieve them?
Sure. So, I think about where we're going as a foundation through three lenses. One is growing the foundation. Tracy talked about the foundation's 15 years old. It's still in its early stages in terms of its maturation compared to some other foundations. So, we're trying to put a strong base in place right now to grow it in terms of its size, its donor base, in terms of how well known the foundation and the hospital are across Ontario and Canada. So that's kind of the first area that we've been really zoning in on. The second area, and building off the first one, is the donor base. We want to bring in more donors. We want to make sure that they understand that the dollars that they donate to the hospital are being used in an efficient and effective manner in terms of improving people's mental health. And then the third big area of focus for us in the coming months and years is our first major comprehensive campaign. So Ontario Shores in the past hasn't had a well-known, visible campaign, so we'll be launching one in the coming months, and we're very, very excited about that, and Tracy's integral to getting it off the ground.
Excellent. I do have a question for you, Joe, around how do these goals intersect with the overarching objectives of Ontario Shore Centre for Mental Health Sciences?
Sure. So every dollar we raise and the support that we receive from the community, both here within Durham, but also provincially and nationally, allows us to bring in more world-class care. So it helps us upgrade our facilities. It allows us to bring in physicians and medical professionals that allow us to do an increasingly better job of delivering mental health services. And it allows us to expand the mandate of the hospital to take on new and interesting things in terms of effectively treating people's mental health. So, like I said, it's not just dollars for construction. We're doing a lot of interesting, really cool things with the funds that we bring in through donors.
Thank you, Joe. My next question actually is for you, Tracy. We talk about the much needed funds raised for programming, moving into a campaign. I know a question that's frequently asked of those who work in fundraising or foundation is, what does the government fund?
That's a great question. I appreciate you asking me that. So the government can't fund everything. This is one of the things that the foundation exists for a reason. It's very purposeful. So the government doesn't fund all of the equipment cost. It can't fund all of the programs. It actually, here at Mental Health, at Ontario Shores for Mental Health, it can't fund all of the operating. So donor dollars go directly to funding programs that wouldn't otherwise exist. So the Women's Clinic is one of those. The Recovery College program is another. And again, some of the capital equipment costs. So the hospital beds that you're lying on. All of these are things that are enabled by community support. So vitally and critically important, especially at this time as our mental health crisis continues.
Excellent. You both have referenced a number of things, and throughout the series of Mental Health Matters, we actually do an episode on Recovery College. We have some guests who have received very critical and important treatment through our women's clinic. So all great segues into other episodes and more information we have. And of course, anyone who'd like to learn more about any of our programs, initiative, or of course, the foundation can visit our website for more. Thank you both for joining us today.
Thank you.
Thanks for having us.
It's Mental Health Matters, and thank you for joining us. We'll see you soon. Now that we've laid the foundation, let's dive into the tangible impact of Ontario Shores Foundation. Joining us is Colin O'Regan, board member and campaign chair for the foundation, as well as Tracy Clegg, joining us once again, foundation CEO. It's fantastic to have you both here. Welcome. Thank you for joining us for this segment. Colin, my first question is to you. Can you shed some light on the impactful programs and initiatives that the foundation funding has brought to life? How are these initiatives reshaping the mental health landscape?
Well, I think where I start that conversation is about my own personal journey, in that I came to the Durham region a little over 20 years ago and set down roots with my wife and now 3 children. And probably for the first half of my professional life, I spent about 10 years supporting volunteer and financially in the acute care sector. However, I go back to about 7 years ago, I was invited to participate in a tour of Ontario Shores mental health facility. And, that 90 minutes really did change the path that I was on moving forward. It really awoken me to a few different things. First of all, the gap, the funding gap when it comes to mental health funding from all sectors of our society, whether it's private but also public, and not being able to meet the needs of the massive amount of needs that are out there. But I also came to the realization that this place is magic. It treats mental health illnesses in such a different way than what we're used to in the acute care sector. And I really, really immediately walked away from there realizing that the journey that I'd been on my whole life, I never really respected and gave credit to people with mental health needs. And it really does impact all of us, our own families, our neighbors, our work colleagues. Every sector of our society is in need of help to get through the day by day. And really from that point forth, I became a board member shortly thereafter and took the steps moving forward to redirect a lot of my time and energy towards mental health. So when we now look at the partnerships, you know, there's two that really jump out, and this really is how this space is going to have greater success moving forward, and that is with the partnerships in the community. And, you know, one that jumps out at me is the Women's Clinic. Gotten some exposure to it through speaking with several of the participants in that program. And really it's there to ultimately help females who are really struggling with the day-to-day life and the struggles and the stresses. And one of the great partnerships that popped up with the foundation and the hospital in the last few years was through Shoppers Drug Mart and the Run for Women. And it really, really has taken it to a different level. We were so proud to have been selected, Ontario Shores and Whitby, as a site for one of their annual runs. And just in the last couple of months, we've hosted our very first full in-person site, and it was amazing to see the hundreds, if not thousands, of both participants but also supporters. And it's all about just not only raising money, which continues to grow, but it's awareness. Everything is about awareness in this part. And, you know, another one that stands out to me is something we call the Recovery College, focused on post-secondary, support. And a lot of it is driven by peers helping others that have been through the process and kind of building the tools within them. And, you know, over time, we've had support private families such as the Marinucci Family Foundation. I think of others like the RBC Foundation that has also helped us from a corporation side. And when we look at each of those examples, they really would never have been able to thrive in the way that they are without the gracious help of partners such as that. So I think when I now start looking forward and I look at our upcoming campaign, a major focus is going to be put on our eating disorder unit. And that unit is all about getting people early in the process. We don't get at them early. We do find that the long-term success rate is certainly considerably lower. So it's so vitally important to provide our young people with the support and the tools to manage it. And, I think it does impact so many of us out there. And all it takes is one little touch with one of these people and you realize the importance of it. And, Ontario Shores has brought the challenges and is providing the solutions not only to the community of Durham and the catch basin of Ontario Shores, but really is beyond Ontario and outside of Canada. So we really are world-renowned leaders out there and really looking forward to kind of elevating that message on a much grander scale with the upcoming first campaign that we're going to host.
Excellent. Well, a couple of things. First, Colin, having community leaders like yourself involved with not only the foundation but the hospital itself is an honor, and we need people exactly like you to help raise awareness, reduce stigma, and of course raise the much needed funds to fund programming at Ontario Shores, which is a segue to my next question, Tracy. Could you share with us any further insights on how these foundation-funded programs align with Ontario Shores' commitment to innovation and compassionate care? And how do they resonate with the larger mission of enhancing mental health in Durham Region and, as Colin said, and beyond?
Sure. So, Colin said it so well, like I think about the foundation's role, and, we use the word foundation, but really the foundation represents the community. The foundation is really the tool that the community can use to demonstrate their support for mental health. And it's with great pride that, Colin and I sit here because we're able to lend that support and demonstrate that through what we're doing here through the foundation fundraising initiatives. And specifically, I think about, the Shoppers Drug Mart Run for Women, and certainly the women's clinic that was enabled. So we enable possibilities thanks to those community funded supports. One of the sort of analogies that I'll use, and it's sort of a symbolism, I guess, that, we talk about the water and the buoyancy, and it's sort of what we'd call our brand story these days, where the water's coming ashore to the shore. And it's really about the connection of the community supporting the hospital as the hospital supports our community. And it's really bringing that compassionate vision together for recovery and hope. And, as we journey forward and think about the things that the foundation has done already, we really we have to raise more money and more awareness. And we can only do that with the community behind us. And when you talk about the community, we're not just talking about donors. We're talking about our patients, our caregivers, our doctors, and those that really want to come behind this mission, because it's not just mental health at Ontario Shores we're changing. We're trying to change the face of what mental health looks like here in Ontario. So we have a big job, and I'm glad that Colin's going to, help me get there with broadening that spectrum for what we're trying to do here. The other piece that I would say as well, and it's something I certainly didn't know when I came here, is that Ontario Shores is touching the lives of some of the most complex patients, and not just, when we would think about, psychiatric care of some emergency things that we deal with here, but we're talking about adolescents from as young as 12 all the way to our geriatric patients. So Ontario Shores is really looking at that, I'm going to use sort of the complexities of care throughout your lifetime, and Ontario Shores is life-changing in the way we're affecting care here. So we have a big job.
Absolutely. Thank you for sharing insights with us today. And thank you again, Colin, for the work that you do. And Tracy, thank you for the work that you do for the foundation and beyond. As the segment draws to a close, anyone who is watching or listening who is interested in getting involved, whether that be making a donation, large or small, volunteering or participating in an event, can visit the Ontario Shores Foundation website and learn a little bit more information. As Colin shared, a tour can be transformative, and we are always happy to provide more information and tours to anyone who is interested. Thank you both.
Well, thank you.
Thank you.
Welcome back to Mental Health Matters. I'm so pleased to welcome two very special guests, and of course, Tracy back in this segment. First, we have Regional Chair John Henry joining us. Thank you. Welcome, John. And then we also have new Foundation board member and longtime supporter of Ontario Shores Foundation, sales rep with Sutton Group Realty Heritage. Welcome, Jacqueline Tanner.
Thank you.
Welcome, and thank you for joining us again, Tracy.
Of course, thank you.
To get started, my first question is actually for Regional Chair Henry. Again, welcome and thank you for joining us. Can you share a little bit with our audience how Ontario Shores has impacted your life and what continues to fuel your passion for Ontario Shores and your strong advocacy for mental health and mental health care in our region and beyond?
Well, my relationship with Ontario Shores goes back to 1978 when I had just got out of high school and started with the first company I worked with. And I actually did work here for a number of years and got to see the great work that staff had done and continued to do with the people that were here. On a personal note, my dad had some significant challenges in his life and suffered from a disease called osteomyelitis, which is really an infection of the bone marrow. And when he was a young man, it can be treated now very easily with antibiotics, but when he was born, there was nothing there. So his addictions to morphine and alcohol and his eventual trying to hang himself brought him here. And he spent over 3 months here and got the treatment that he needed to make his life a little bit better. And I got to see firsthand the continued care that goes on here to make his life a little bit better, and his challenges were large, and seeing him and how he was treated here, brought hope to our family.
Although I'm very sorry to hear of the impact and struggles with mental health that your father and your family faced, I am happy to hear that Ontario Shores was there when you needed us.
Yeah, it was. I often refer to this facility as a lighthouse. It's the place where people go when their lives are in trouble or stormy, and we're very lucky to have this facility located here in Durham Region.
We certainly are, and it couldn't be more fitting that we are on the beautiful shores of Lake Ontario, which really adds to a sense of peace and hope to our patients. Jacqueline, as part of my intro, I shared that you're a longtime supporter and new board member of Ontario Shores Foundation. That is incredibly inspiring, and it's amazing to see that transformation of your relationship with our organization. Could you share with us your inspiration for getting involved and the transformative experiences that you've been a part of or witnessed as part of your time with Ontario Shores Foundation?
Certainly. Thank you, Julie. I first came to Ontario Shores actually with a donation because our longtime friend's son, who was a first responder, unfortunately lost his battle with PTSD. And I came into the facility and was given a tour. At that point, I was introduced to the Family Resource Center, which I knew nothing about. I didn't realize there was such a place. And it's such a wonderful place for people to get information, and they don't have to be registered with the hospital. From that point, it took me on to inquiring about sponsorship, and I'm very proud to say that I'm part of the Mental Health Conversation Luncheon. Such inspiring speakers we've had over the years, and also the annual Makeup, Mocktails, and a Movie. And I never thought that Ontario Shores would be able to put on such a lighthearted venue. So continuing on, in terms of my own profession, we as a realtor get a very intimate look at people's lives. And I often see firsthand how people shy away from their own personal or their loved one's struggle. So I think having awareness, acceptance, and support of the public is so important.
Absolutely. And having community supporters like yourself who are very active in a number of ways really demonstrate that helps to really reduce the stigma and encourage that community support and collaboration. So thank you for that.
Well, I'm hoping that as a realtor out in the business community, I will be able to be a good ambassador for Ontario Shores.
I have no doubt about that. As the president and CEO, I'm sure a strong emphasis in your role is really getting involved and creating that pipeline for organizations and individuals to get involved from a community or grassroots level. How do supporters like Jacqueline and John contribute to the foundation's mission, and how can others follow suit if they're interested in doing so?
Great. Thank you for that question, Julie. I've not been here as long as Jacqueline and John, certainly in their involvement with Ontario Shores. And one of the sort of shock and awe moments I'd say I've had here is the fact that there's such longevity of loyal community support. And I have such pride sitting with these two fine people because they're choosing to be such vocal spokespeople for Ontario Shores and lending their voice, lending their stories and their personal connections, much like I have my own personal connection. That's what we need more of, because we don't want to shy behind the stigma of mental health. We want to get out in front of it. We want to share our passion for change and be champions for change. And, the pride I have working at this foundation, and I get goosebumps every time I talk about it, is that we get to be the voice for the community. We get to represent Ontario Shores in a very vocal way and give a voice to patients that perhaps can't speak about it the way perhaps John and Jacqueline and myself sometimes can. So, the events that Jacqueline spoke of, John runs an incredible event through the Regional Chairs Golf Tournament that's been giving support to Ontario Shores for so many years. And these are things that are making a impactful difference every single year. We have our Shoppers Drug Mart Run for Women that this year raised $50,000 more than the prior year. These events, they bring people together. And we need the money. Of course, we need the money desperately, but we need the voices. We need the people to care, and we need people to know that Ontario Shores is here, and it's here for them. We talk about this hidden gem here in Ontario Shores in Whitby, and we're so proud it's in Durham Region. Our job is to make it not a hidden gem. We want it to be a beacon of hope, a beacon of strength, a beacon of recovery. And I'm just so grateful that John and Jacqueline will sit here and be a voice for our foundation and for our hospital. So that's what the role of this foundation is. So thank you, Julie. Thank you for this opportunity. Thank you, John and Jacqueline.
Yeah. Thank you, Tracy, for that. I couldn't sum that up better. And thank you. I echo Tracy's comments. It's an honor and a privilege to be sitting here and having both of you here represent both Ontario Shores Foundation and Ontario Shores Centre for Mental Health Sciences. And thank you for all you do.
Thank you.
Thank you.
Welcome back to Mental Health Matters. Joining me here, I am so pleased to introduce you to Lori and Dan O'Neill, founders of the annual golf tournament Par for the Cause. Welcome.
Thank
So
you.
happy to have you here today. And of course, Tracy is back with us for this segment, CEO of the foundation. Welcome back, Tracy.
Thanks,
Thank
Julie.
you for being here. To get started, my first question is for you, Lori. What inspired Par for the Cause? Or would you prefer Dan answer that one?
I think I can answer that one.
Perfect. And what brought this charity to life?
Okay, back in 2019, a group of family and friends got together, and we decided that we wanted to raise money for two important issues that affect all of us: cancer and mental health. And we got together and we decided to raise money for Princess Margaret Cancer Foundation and also Ontario Shores Recovery College. We started off as a small group, and now we have a committee of 14 devoted members and also volunteers that help on the day of the event. We had started raising money for Princess Margaret almost 15 years ago, raised almost $1 million for this one particular doctor. And so we knew where that money was going to be focused, but when it came to Ontario Shores, we met with a foundation member, took a tour, and the group of us all just, this is where we're going to raise our money, and we wanted to focus on Recovery College.
Wow. In this episode, we've talked a lot about Recovery College and the amazing work that it does, so thank you for that. Dan, can you share with us the impactful successes achieved since the conception of Par for the Cause?
Absolutely. Probably the biggest win we had was being able to launch right in the middle of COVID. All the other tournaments were canceled, a lot of other fundraisers were canceled, and the charities that depend on those money weren't getting that. So we were very fortunate to be able to get ours off and running in August and raise the money that we did. We've grown every year. We've gone from 120 golfers to 180 golfers. We've grown the number of sponsors, the number of sponsorships. People volunteer. We've got more volunteers than we need. Individuals and businesses in the community, whenever we ask them to tell them what we're doing, they're right there to help, to donate for auctions or just donate towards the cause. Through our first 3 years, we raised over $118,000 that we split equally between the two charities. And every year we seem to be able to raise more money than we did the previous year. And this fourth year looks like it'll continue the trend.
That's an excellent trend, and what a true inspiration of community support and really rallying together to raise money for two very important causes. So thank you for that. Tracy, how do community events like this align with Ontario Shores Foundation's goals?
Sure. You know, specifically, you talked about Recovery College, and our strategic sort of fundraising goal, and specifically over the next 3 years, is actually around research, academics, and innovation. So talking about Recovery College and the empowerment of what Recovery College does, bringing a voice to it, and the fact that you're choosing to partner with us. And I think about charity of choice. You chose us. We didn't choose you. And we're putting a voice and a choice in the hands of people that perhaps can't make a choice for themselves. So I thank you for that. I think about the advocates. You spoke about the number of volunteers, that you've got too many now, the people that are coming by your side to help us raise money now. Thank you. You know, it's my job to raise money. It's my passion to raise money. You're choosing it personally out of the goodness of your hearts. The foundation is doing everything we can to raise more money and to destigmatize mental health. And because of people like yourselves that choose this, we're doing it. We're going to win this battle.
Great.
Thank you. Dan or Lori, what advice can you offer to individuals aiming to make an impact on mental health awareness or reducing stigma or advocacy, as Tracy mentioned, in their own community?
I guess if you have an idea, jump in. Take the plunge, turn that idea into a reality. Talk to family and friends like we did. They're probably right in line with your thought process. They'll be ready to help. It's a lot of work. You get a lot of people involved. It's not as much work as you think, and it's very rewarding. Volunteer. Use Google. Search where the different fundraising events are on in your area supporting mental health, and become a volunteer or a participant. Make a donation. Be a volunteer. It's really easy.
And anyone who would like to, it's an annual event, if anyone would like to donate to this event or get involved, they can certainly connect with the foundation, connect with Tracy and her team to connect with your organizers. Thank you for the work that you do. It's truly inspiring. And we wish you luck in your event. And thank you for thinking of Ontario Shores Foundation.
Thank you for the opportunity.
Hello there, this is Karim Mamdani, and I'm proud to introduce myself as the President and CEO of Ontario Shores Centre for Mental Health Sciences. Thank you so much for tuning into today's episode and for joining us in these important conversations about mental health. I just wanted to take a moment to express sincere appreciation to the incredible team at Ontario Shores for their exceptional work. Our team of compassionate and skilled clinicians and staff work tirelessly to provide life-saving treatment and unwavering support for our patients and their loved ones who are facing the challenging impacts of mental illness. At Ontario Shores, recovery is possible and there is hope. I invite you to visit ontarioshores.ca to learn more about our work. On our website, you can explore our career and volunteer opportunities, learn about our programs and services, and find out how you can make a difference through donations.